Dr. McCullough, thanks for coming on today. One of my questions would just be around FDA approval. I know you've mentioned previously that these vaccines were not FDA approved, and there's been some things in the news, specifically even up to the White House, where they said these vaccines were FDA approved. Can you just talk a little bit about the confusion there?
On August 23rd, Pfizer met in a closed meeting with the FDA. There was no advisory panel, no external experts there to watch or take minutes or present. But what came out of that meeting was a continuation of the emergency use authorization to Pfizer. So Pfizer was not approved by the FDA. And then there was a biological licensing agreement assigned to BioNTech, a German partner, for their vaccine. But that application must have a commitment to post-marketing studies, many post-marketing studies about myocardial injury after the vaccines, heart injury, myocarditis, special language about safety in pregnancy. And so if BioNTech wants to move forward with a product, if the German company wants to enter the US market, they have to do all that and commit to that. They have to write a package insert, and then BioNTech would have to, produce a product and distribute it in the United States. That hasn't happened. So Pfizer is still under the emergency use authorization. Americans know Pfizer's not approved because the consent form didn't change. And insurance companies don't have to approve it. Insurance companies are not paying for it. It's still the same old Pfizer. And the consent forms simply say that we don't know if this is going to work and we don't know if it's safe. The consent forms are asking Americans to participate in research. And that's what the emergency use authorization is. So there was a false talking point that came out of that meeting and went all the way up to the president of the United States, who said that Pfizer was approved when it was not. And, within 7 days, Dr. Gruber, who signed the letter for BioNTech, the high-ranking vaccine regulatory official, she resigned. So if that tells you anything.
So my question is around the testing, right? So we've seen places like Kroger and Walgreens, they've actually increased the price of their tests from $14 to $24. In your professional opinion, is that just based on supply and demand, or is there a bigger thing going on there?
It's supply and demand. Everyone's got COVID-19 now. I think almost all my patients do. There's almost complete capitulation. We heard reports out of California yesterday that even if people test positive, they should show up to work anyway, because it's so ubiquitous now. So what I'm telling my patients, if I have a high risk senior citizen, I'm really wanting to know if it's COVID or not, I'll have them get tested. But we should be doing 0 tests on people without symptoms because it's never been FDA approved to do that. It's not supported by any of the science. It's not supported by WHO or CDC. That means all the testing in schools or employers making people do tests once a week, travel, crossing the border, all that needs to stop immediately. It's a giant waste of testing. We know when people are asymptomatic and they test positive, 97% of the time it's a false positive. That's what's going on in the NFL, the NBA, all the sports teams, NHL right now, is they're just generating tons of test results and having people quarantined for no reason. The CDC finally capitulated on that too and said, even if you test positive, you could go to a 5-day quarantine period. That's if you're asymptomatic. We've gone ahead and extended that to clinically patients with COVID-19 illness, provided the last 2 days they don't have a fever or severe symptoms. So I think a lot of this is just breaking down with Omicron. Omicron is so ubiquitous; it doesn't respond to the vaccines. Everyone's getting it. It broke through natural immunity. It broke through vaccine immunity, and it's like getting a common cold.